welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Today in the show we have Rehaan Shaffie. He is a hospitalist and he wrote the KevinMD article, The Worst Code I Ever Ran. Rehaan, welcome to the show.
Thanks for having me. It's very nice to meet you.
So we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Yeah, absolutely. So I'm a hospitalist. I'm based out of Denver, Colorado at a safety net hospital here. I'm originally from Kansas, did my med school training there, and then did my residency in the Bronx, New York, which is where the story takes place, also at a safety net hospital. And that's been my chosen practice setting and has really formed my career and my experiences along the way.
So tell me what some of the challenges are practicing inpatient medicine at a safety net hospital in particular.
Yeah, as you might imagine, the patient population is underinsured or uninsured in most of these locations. That influences not just the resources that we have available to take care of these patients, but all of the determinants of health that they experience. And so it's a high level of comorbidity. It's a low level of external hospital resources in terms of finding patients that have social support, who have not had experiences with things like incarceration, homelessness, poverty. And so it's an intersection of social factors and medical factors that create a pretty unique practice environment.
So as a hospitalist, what are some of the biggest differences that you could make for this patient population at safety net hospitals?
Yeah. I think that there are a few things we can do, and some of them are very personal because the patients that we meet, they often view individuals that are a part of an institution the same way, whether that's folks they interact with in the criminal justice system, in correctional care, or in healthcare. There is something that is official, bureaucratic, and administrative about all of these organizations. And whether or not we intend to be representatives, we are representatives of a larger system. Mm-hmm. And by treating patients with empathy, dignity, and respect, I think that we can change the way that they interact with these systems, even on a small scale. And I think everyone has experienced this, where you have a patient who is quote unquote difficult because of the experiences that they've had with representatives of a larger system. And the more that we can do to treat them as human beings, the better those relationships will be, the more engaged they'll be in their care, and very optimistically, the better their interactions will be with representatives of different parts of that system. More broadly, we can deliver quality clinical care with a high level of compassion and create, hopefully, a reputation for our safety net institutions, that these are places that are representatives of the community and can influence public health in that way.
All right, let's talk about the KevinMD article that you wrote. It's titled The Worst Code I Ever Ran. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
So the article takes place toward the end of my second year of internal medicine residency in the Bronx at that safety net hospital. It was a very high acuity, high volume, and low resource environment. And along with that came a lot of exposure to critical illnesses. And so the article focuses on one particular experience I had during a night admitting shift. I was extremely busy, taking care of multiple patients at a time, and a code was called overhead on the floor that I was on. And as I'm running that code, a patient who had recently come through the doors, who I had just kind of shaken hands with, and we often do these visual assessments and rely on observation skills to determine if folks are sick. Just really briefly met her, and then she went to her room, and then she coded across the hall. Mm-hmm. And so I had what I think is hopefully a unique experience of running two codes at the same time, running back and forth across that hallway. And the article is about my experience doing that and the effect that it had on me.
So take us into that night as you're running the code. Give us a picture of what you're experiencing.
So has anyone that has been through residency knows going to that code or that emergency situation at the end of your second year, I walked in with a lot of confidence. I walked in with someone that had run codes before, that had been a part of a lot of codes at that point, unfortunately, but felt very good at the very start of this experience. And then everything flipped when the second code was called. There was a period of confusion where I thought there was a mistake, and I go across the hall and I see my medical student, and it's one of those images is always going to be with me, of looking at his face, and he's so pale, and he's standing over this woman that we had just briefly met for less than a minute probably. And everything changed for me. Was very calm. I felt like I had my heart rate under control, my breathing under control, and I felt like I was anticipating this ACLS algorithm to walk through for the first patient. And then when this happened, I sort of had that feeling that I had at those very first codes, where your heart rate goes up, your face feels flushed, you start to sweat, and all of a sudden there's this pressure on. And thankfully, the med student was excellent, and he was there, and I was able to ask him to start compressions, and he did. And I think as soon as we started that first step, that my sense of the algorithm kicked back in. Mm-hmm. And then I don't think I was very internal at all for the next 15 minutes. It was very external. So I was really focused on the algorithm and just keeping track of where I was, going between rooms, and focusing on what needed to be done. And it wasn't until several days later that I really had a chance to sit down and process what had happened, which I think is really typical of a lot of the critical situations, a lot of the traumatic situations that providers find themselves in. There's not time in the moment, and there's not space in the moment to process those.
So as you reflected on that experience, what kind of conclusions?
Well, I think from a personal and professional perspective, it did end up actually giving me a little bit of confidence that I could do things and push myself in ways that I would very objectively find uncomfortable. And as a result, that made me more comfortable in future situations. I think in terms of coming to the point of writing the article and reflecting on it in that way, particularly it became obvious in the last 2 years of the pandemic that there should be opportunities to reflect on experiences that are really life-changing. And sometimes I think just because of the nature of what we do, we don't fully appreciate how life-changing it is to see someone die or to touch them in their last moments and to be trying to bring them back, and to be unsuccessful or successful. It's still just a really monumental life experience. And there aren't many avenues to share those. I think the most impactful part about that experience was really at the very end, which is that I just went back to work. I think maybe even more so than the fact that there were 2 codes going on at the same time was the idea that in this job, you just go back to work. And there are a few other jobs like that for sure, but it really just made clear we have to find space to process these things and to deal with them the way that they should be dealt with. And I don't know if we really have an avenue like that right now.
So in your residency program, after you had that horrific call night, running 2 codes at once that affected you to the core, how about your peers and chief residents? Did you have any formal debriefing period, or was that just considered just a typical night?
That was more along the lines of a typical night, really. Residency is one of those unique and really special experiences where you do become so close to the people that you're with, because no one else will ever have the experiences that you had. And so you do have that support system. And I did really rely on my co-residents, seniors and juniors, and that medical student that shared in that experience with me. But there wasn't that formal debrief, as the senior resident in charge of the code team. you just keep going, come
Yeah.
back the next night, do some more admissions, run some more codes, and try and do it better.
Now, from a teaching standpoint, I know I'm sure that you had a lot of lessons to give that particular medical student, but just for other new residents in general, they're going to be confronted with something like this. What kind of advice can you give to them to better prepare them for this experience?
I think the advice I would give them, I give a lot on teaching rounds as well, which is that the best learning is when you feel uncomfortable.
Mm.
And whether that is something small on rounds, such as taking the opportunity on rounds to tell your attending that you don't know something and feeling the discomfort of that, it will drive home the lessons that are coming much more concretely than any other experience, than any other response. And I think the same applies in a code situation. At the beginning, you're learning and you have to be willing to walk into a room and declare yourself the code leader and use the knowledge that you have to start that process, and then use your team members and tell them, hey, there are experienced nurses that are going to be around you, experienced RTs that are going to be around you,
Mm-hmm.
other folks on the code team, and you have to say, hey, what's next? What am I missing? What am I not thinking of? And I'll still ask questions in a code,
Yeah.
which I think is the sign. Ultimately, at the beginning, it's a sign of being a learner. And I think as you become more experienced, it's a sign of being a good leader, because that room is full of people with knowledge and experiences and perspectives. And if you don't utilize all those, you're just taking tools out of your toolbox.
Yeah, I think that's a wonderful point, because sometimes when you're running a code, you have that compulsion to pretty much do everything, and you lose
Mm-hmm.
sight of the fact that you do have experienced respiratory therapists, nurses, medical
Yeah.
students, your co-interns, co-residents helping you out. And at that moment, sometimes it's hard to
Mm-hmm.
draw upon their help.
Yeah, absolutely. Especially as a resident, because you do feel that pressure, whether in your mind or whatever it is, you just feel like the spotlight's on you. And so it's hard to take a step back and think about all the other people in the room and what they have to offer.
So experiences like these, how did it prepare you for, say, the pandemic over the last 2.5 years? Because I could imagine you've had equally intense experiences during the pandemic as a hospitalist.
Yeah, I was speaking about this with a colleague the other day, actually, and we decided on the term learned resilience as something that we really appreciated from our training. There are multiple ways to be resilient, and there are multiple ways to become resilient. And I think that the experiences that I had in residency, and that one in particular, there are two responses coming out of that. One is to really let it affect you in a negative way, and the other is to try and find ways to process it in a healthy manner and become more resilient as a result of it. I certainly didn't do that alone.
Mm-hmm.
Like I said, I had co-residents. I have a family, a support system. I've gone to therapy. A lot of people have gone to therapy. There are multiple ways to recognize what it does to us and to deal with it in a healthy way. And I hope that more people that have these experiences realize that it can eventually become something that builds that feeling within you, that resilience within you.
So you mentioned that you went to therapy to help debrief you and help you process these traumatic experiences. Now, not every physician does that, right? When seeking behavioral health help, sometimes it's interpreted as a sign of weakness, and physicians are supposed to tough through situations like this. What was your decision-making process in terms of seeking behavioral health help?
Yeah, I think I was very lucky to have friends and family members that had more mature perspectives than I did at that
Mm-hmm.
time, especially as a trainee. I was very much a part of that culture, that mentality. You tough it out, you go to work when you're sick, you deal with these experiences, you make jokes about them, you're just tougher and stronger, and you have a thicker shell, and you just keep going. And because I had people within my social circle that helped me reflect on what those experiences were like from an external perspective, like I said, if you take a step back, if you're able to take a step back and realize how remarkable it is and rare it is to have your hands on someone when they die is a really remarkable thing. And so to have other people be able to provide that perspective to me helped me reach a point where I realized it was something that I needed. And I think that coincided with this realization that it also wasn't going away.
Mm-hmm.
Because I just went back to work, because so many of us just do go back to work. It'll never go away. And I thought about that experience honestly probably once a week until I wrote the article, because you just keep moving and no one will ever come back and ask you about the things that really impacted you and really made you uncomfortable and were really traumatic. And so after 2014, after all these years, still no one had asked me and no one was ever going to. And so I just needed to tell the story. And so those things kind of came together and made me realize, all right, you're going to have to find a way to tell this story in healthy ways for yourself if you're going to keep going in this profession.
So when you talk about these external perspectives that people not inside of medicine gave you, you mentioned some of them told you how rare it is to have your hands on someone as they die. Mm-hmm. What else did it tell you? I'm interested in hearing what other external perspectives kind of swayed you.
I think also hearing that it was very common to go to therapy. It was very common to share traumatic experiences in other settings. It was very common to process those things without a culture that promotes pushing that down and moving on and getting on with the work. That was helpful for me to understand that medicine can feel so insular at times, and the way that we do things, it's hard to see how other people do things in other industries or other professions. And then I think when you start to realize that, it's a helpful perspective, because it showed me, hey, there's other ways to do these things. It doesn't have to be this way.
And my final question, what are some of your take-home messages that you want my readers to, or my listeners to, come away with after hearing your story?
Hopefully people feel very motivated to talk about the really important experiences in their life, and specifically within their career in medicine. And hopefully they seek out ways to do so without being asked. And they seek out resources that make them feel empowered to tell those stories, whether that's writing a blog post or speaking with their partner or that family member. This was not a story I had even told my wife, or going to therapy. I think there are so many things that we do that are really unique to our experience as physicians and as human beings. And the last 2 years for everyone in medicine has been full of those experiences. And so I know that everybody has them and everybody has that story. And I also know that we're moving on, and we're all moving on to the next thing, and we're getting ready for the next phase in our career. But we just lived through a once in a lifetime event, and we experienced a lot of things that many people will never experience again. And I think that it's worth talking about.
Well, thank you so much for sharing your story, time, and insight. And thanks again for being on the show.
Thank you. I appreciate the opportunity.